guys, so today's lesson is on pelvic inflammatory disease. So pelvic inflammatory disease is an infection of any part of the reproductive tract, and this is in females, okay? This is caused by changes in the mucus in the cervix, which basically serves as a protective barrier and keeps the bacteria out. If the barrier is not working as it should, bacteria can get into the uterine cavity and cause infection and inflammation in the uterus or the other reproductive structures if it spreads. So like most infections, pelvic inflammatory disease can be fatal if it's untreated.
Click the link below or visit nursing.com/NFN for a free NCLEX ebook covering the 77 key topics.
So the most common cause of pelvic inflammatory disease is STDs, like chlamydia and gonorrhea. So how exactly is an STD transmitted? Sex. So the bacteria enters the vagina and is able to spread because there's changes in the cervical mucus or the vaginal flora. With a change in the cervical mucus, the protective barrier is basically broken, which allows bacteria to pass through the cervix. So the body has another sort of kind of protective mechanism, and this is the vaginal flora, which is the good bacteria that lives in the vagina. So with overgrowth of the vaginal flora, it throws off the pH, and it makes it more susceptible to infection. Another cause of PID is an infection of any of the pelvic structures. So this could be like a pelvic abscess, because basically the infection can spread to the reproductive tract and lead to PID. Okay, so let's go ahead and look at the risk factors real quick. One of the risk factors is having multiple sexual partners. So the reason that this is a risk factor is because there's a higher risk of contracting STD. IUD placement also puts the patient at a risk for development because there's a chance for bacteria to enter the uterus during placement. And since STDs are a common cause of PID, they're definitely a risk factor. And like I mentioned before, an infection somewhere else in the body, like one of the pelvic structures, is also a risk factor because it can lead to PID. With PID, it can cause inflammation and scarring to build up in the fallopian tubes, which can interrupt the natural flow of the eggs. So there is inflammation and scarring in the fallopian tubes, which prevents the eggs from traveling through the fallopian tube from the ovary to the uterus for implantation, okay? So the egg can get stuck in the fallopian tube, and this can cause ectopic pregnancy and infertility. Ectopic pregnancy is not a complication of PID, but having PID puts patients at a higher risk of ectopic pregnancy, even up to a year later. So since PID is an infection, patients can have serious complications, like sepsis and death. If there's a delay in treatment or inadequate treatment, these are two of the consequences that can happen.
If you need more help breaking down complex topics like this one, make sure to head over to nursing.com/NFN. Click the link in the description below or scan the QR code to unlock your free NCLEX review that covers 77 must-know nursing topics. Make sure that you learn this, that we love you guys. Now go out, be your best self today, and as always, happy nursing.